My name's Simon Elcock. I work at Library House Surgery in Chorley. It's a very large GP practice. We have 16,500 patients. We have 8 GPs, we have 4 training doctors, we have 4 advanced nurse practitioners, 4 practice nurses, 2 healthcare assistants. A year and a half ago we actually did a bit of an analysis of some of the threats maybe to primary care. And one thing we picked up on was some of the private providers out there using video consultations. So we decided that was something we're going to look at. We also know that there are problems around GP retention with GPs retiring. A lot of GPs now working part-time and having young families. So we felt video consultations would offer some flexibility. Changes to our current systems and protocols has been quite minimal really. The protocols have been designed by our clinicians and they look through those, and by working through the care navigation protocols, our team are able to offer patients the most appropriate appointments so that they can be dealt with first time. If the care navigation protocols indicate a patient needs a telephone consultation or a routine appointment, we then just moved on to ask a couple more questions, which was, does the patient require a physical examination? If the answer comes back no, then we just do a check around technology. Do you have a smartphone? Do you have a computer? Do you have a laptop with a webcam? Do you have an iPad or a tablet device? If the patient then comes back and says yes, we then move on to offer the patient a video consultation. The setup we use is the GP, when they're working at surgery, they have the normal computer, and for the video feed between the GP and the patient, we just use an iPad. So setting up the iPad is very easy. It's a web address, so the GP just clicks on the Safari icon. When the Safari icon opens up, the GP then clicks the Visconn Clinic icon. They put in the login details and they go straight into the Visconn waiting room. And they can see when a patient joins that virtual waiting room. When they do, they just tap the join button and the video consultation starts. One of our doctors has used the system at home, and what was great really was because they became familiar with the equipment in surgery, it didn't seem that that different to them when they were at home, so they felt quite comfortable with the technology. One thing as someone involved in technology I thought was great was when I was speaking to the team at Visconn Clinic, who we've built a good relationship with, I was able to go to them with what I called like a development wish list, and it was just little tweaks to the system that I thought would make things easier for myself and for our reception team when setting up appointments. So I passed on that wish list to the team. In a matter of a week, those changes were made. Our patients seem very keen on video consultations. Generally, if we offer a patient a video consultation and the patient feels it's appropriate and they feel comfortable with technology, they will accept that appointment. We're finding a lot of patients maybe with low mood or anxiety problems, or patients who require appointments to review their medication, feel it's a really convenient way for them to consult with their doctor and save them coming into the practice. We've had some great feedback from our patients who've used video consultations, and we've got one great particular bit of feedback where an elderly couple who really struggled to get to the surgery, they've both been involved with video consultations and passed on their thanks for making this available to them, and in future they'll be using video consultations.